Most people try to look younger by adding things in the morning, but the biggest upgrade happens when you subtract friction at night and let sleep run its repair work. After 40, many women notice that one night of light sleep shows up on the face faster than it used to. The skin can look dull, the eyes can look puffy, and the mood can feel sharper in a way that makes everything feel harder. That is not vanity. That is biology. Your face is a dashboard for your nervous system, your hormones, and your inflammation level. When sleep is deep and steady, the body runs a quiet night shift. It balances stress hormones, steadies blood sugar, supports immune regulation, and gives the skin barrier time to recover. When sleep is light and broken, you can still get through the day, but your face often shows it first because the face reflects the state of your stress system. Now, I will walk you through 6 night rituals for deeper sleep and a more rested, natural glow. The second one is the most overlooked reason people keep waking up, and it has nothing to do with discipline. Before we start, leave a comment with your age range and the one sleep problem that bothers you most, such as trouble falling asleep, waking in the middle of the night, snoring, or waking up tired. Subscribe now so you do not miss the next set of practical habits that protect sleep, skin, and mood after 40. However, a better night starts with the truth that sleep after 40 changes, even in healthy people, and that change can make you blame yourself for something that is partly normal. With increasing age, people often need less total sleep than younger adults, and sleep becomes more fragmented. The circadian rhythm, the internal timing system that tells the body when to be alert and when to be sleepy, can become less pronounced. Deep sleep, the heavier stage that feels most restorative, tends to reduce with age, while dreaming sleep is more preserved. This is one reason many adults over 40 say they sleep, but they do not feel refreshed. Insomnia also behaves in a sneaky way. Some people complain of poor sleep but are observed by family members to sleep more than they believe. Other people sleep very little and do not complain much. Either way, insomnia can be very distressing, and it is linked with worse health outcomes over time. It also becomes more common when medical or mood conditions are present. So the goal is not perfect sleep. The goal is stable, deeper sleep that leaves you feeling more like yourself. Because stable sleep is what your body uses to maintain the systems that support long-term energy, memory, and appearance. This is where the beauty connection becomes practical. When sleep is light and broken, the stress system stays more active. Stress hormones like cortisol can remain higher into the night. Higher cortisol is associated with more inflammation, stronger cravings, and more fluid shifts that can show up as morning puffiness. Poor sleep can also slow skin barrier recovery, which can make the skin look drier and more reactive. So sleep is not only about feeling rested, it is about creating the internal conditions that let you look rested. Next, let us begin the countdown at Ritual 6, because the easiest way to make night sleep more deeply is to stop draining it during the day. Ritual 6 is to reduce or stop daytime napping and to protect a consistent wake time. Many adults after 40 feel a real afternoon slump, especially after lunch. It can feel like the body is asking for a nap, and sometimes it is. The problem is that sleep works like pressure. The longer you stay awake, the more sleep pressure builds. When you nap, you release some of that pressure, and bedtime becomes harder. Then you lie in bed longer, you get frustrated, and the brain learns that bedtime is a place for thinking. If you truly need a nap, keep it brief and keep it earlier in the day. A short nap can restore alertness without stealing too much night sleep. But a long late afternoon nap often creates exactly the pattern people hate: late bedtime, shallow sleep, and early waking. For many women, the best alternative is not a nap. It is a short reset that does not reduce sleep pressure. Try a 5-minute walk outside, a glass of water, a light snack with protein, or a few minutes of slow breathing. You want to feel steadier, not more sleepy. The second part of Ritual 6 is the anchor. Wake at the same time most days, including weekends. This seems strict, but it is one of the fastest ways to stabilize the circadian rhythm. A consistent wake time teaches the brain when the day starts, which helps it predict when night sleep should start. If you sleep in after a rough night, you delay your internal clock and make the next night harder. So even after a bad night, keep the wake time stable. You can always go to bed a little earlier the next night. For beauty, this matters because circadian stability is like a rhythm for the whole body. When your day starts at a predictable time, cortisol rises in the morning when it should, then falls later in the day. That pattern supports steadier appetite, better mood, and fewer late-night cravings. Those changes show up on the face through less puffiness and a more even tone because the body is not stuck in a constant stress loop. Meanwhile, Ritual 5 is to build an evening fence around the most common sleep thieves because sleep quality matters as much as sleep quantity. The first thief is caffeine. Caffeine can last in the body longer than many people expect, and sensitivity often increases with age. Even when you feel sleepy at bedtime, caffeine can keep the brain in lighter sleep and cause more awakenings. So treat caffeine as a morning tool, not an afternoon rescue. For many people, the safest cutoff is early afternoon. If you already struggle with sleep, bring that cutoff earlier and watch what changes after a week. If you drink caffeinated tea at night because it feels gentle, notice whether you still wake in the middle of the night and whether you feel less calm. The second thief is alcohol. Alcohol can make you drowsy at first, which tricks you into thinking it helps you sleep. Yet alcohol often reduces sleep quality, increases lighter sleep, and leads to more awakenings later in the night. It also relaxes throat muscles, which can worsen snoring and breathing problems. Many people wake in the middle of the night after drinking because the sedating effect fades and the body rebounds into a more alert state. That rebound can feel like anxiety, and it can make it hard to return to sleep. There is also a beauty reason to fence off alcohol. Alcohol can increase facial flushing in some people, worsen dehydration, and contribute to morning puffiness. If your goal is a rested glow, alcohol close to bedtime works against you from multiple angles. If you enjoy a drink, keep it earlier in the evening, keep it modest, and pay attention to how your skin looks and how your mood feels the next day. Ritual 5 also includes food timing. Heavy meals late in the evening can disturb sleep, and reflux can wake you up even when you do not feel classic heartburn. A simple pattern helps: eat your main meal earlier and keep late food light. If you need something later, choose a small, calm snack. Many people do well with a small combination of protein and carbohydrate, such as yogurt or a small bowl of oats, but keep it modest. The goal is to avoid waking from hunger without turning the stomach into a working machine at midnight. Afterwards, Ritual 4 is to build a predictable wind-down routine that signals safety to your nervous system because sleep is not a switch. It is a landing. Many adults try to fall asleep straight from stimulation. Bright lights, intense conversation, breaking news, social media, or work messages. Then they expect the brain to shut down on command. After 40, that transition often takes longer, especially if stress is high, if menopause symptoms are present, or if you carry responsibility for others during the day. A routine reduces that transition time by repeating the same signals every night. Repetition trains the brain. It becomes a cue that sleep is coming. Start with light. Dim the lights 1 to 2 hours before bed and avoid bright overhead lighting. Use lamps and let the room feel softer. Light is a powerful signal for the circadian system. Bright light late at night can delay the natural rise of sleep hormones and push bedtime later without you realizing it. Then add a simple sequence that takes 15 to 30 minutes. Wash your face, brush your teeth, change into sleep clothes, and do something quiet. A calm book works, gentle stretching works, a short breathing practice works. Avoid choosing something that feels like a test or a project. You want ease, not performance. Warmth can help the transition. A warm shower or a warm bath can relax muscles and make the body more ready for sleep, especially if you feel tense in the shoulders and jaw. Some people enjoy a warm milky drink as part of their routine. It is not magic, but it is soothing, and soothing is the point. You are teaching your nervous system that the day is over. For women after 40, routine also creates a place to manage common night disruptors. Hot flashes and night sweats can fragment sleep. Breathable bedding and a cooler room can reduce the intensity. A small fan near the bed can help. If you tend to wake because you feel too warm, adjust bedding rather than tolerating it. If you tend to wake because of dryness, keep water nearby. If your mind wakes and starts listing problems, remind yourself you have a plan because Ritual 1 is coming. Ritual 4 also protects the face in a direct way. Late-night stimulation tightens facial muscles without you noticing, especially around the forehead, eyes, and jaw. A wind-down routine that includes gentle relaxation can soften that tension. Over time, a softer face at night tends to become a softer face in the daytime because your nervous system spends fewer hours locked in alert mode. In addition, Ritual 3 is to protect the sleep environment because your brain sleeps with your senses and tiny irritations add up to shallow sleep. A good sleep environment is dark, quiet, and comfortable. Darkness supports the natural timing of sleep hormones. A room that stays too bright can keep the brain in lighter sleep. If street lights leak through curtains, use blackout curtains or an eye mask. If you wake when early light enters the room, darkness can extend sleep and improve morning energy. Noise is another common problem. Sudden sounds are the worst because the brain treats them as potential threats. A steady sound is often easier for the brain to ignore. A fan, a sound machine, or gentle white noise can reduce awakenings. If you live in a noisy area, earplugs can help, but comfort matters because discomfort becomes its own sleep disruptor. Temperature matters too. Many people sleep better in a slightly cooler room. Heat can fragment sleep and worsen sweating. If you wake hot, adjust bedding rather than pushing through. Breathable sheets and a lighter blanket can improve sleep depth. Now add one rule that improves both sleep and mental calm. Keep the bed for sleep and intimacy. Avoid using the bed as an office, a dining table, or a scrolling station. The brain learns associations. If the bed becomes a place for work and worry, it becomes harder for the brain to treat it as a sleep cue. Screens deserve special attention here. Screen light late at night can be stimulating, and scrolling content can keep your mind active even when your body is tired. It also encourages dry eyes, squinting, and tension around the face. If you must use a screen, dim it, keep it brief, and choose something neutral. Better yet, replace it with a calming audio track, a paper book, or a short relaxation practice. A small beauty bonus that many women notice quickly is pillow choice and sleep posture. If you wake with deep face creases on one side, a softer pillow and a more neutral position can help. Many people breathe better on the side, especially if they snore, but keep the neck supported so you do not wake with jaw tension. Beauty is not only skin deep, it is also the small physical choices that reduce swelling, reduce tension, and reduce micro-awakenings. At the same time, ritual too is the overlooked one, and it is about breathing, not discipline, because you cannot sleep deeply if your airway keeps collapsing. Many people normalize snoring. They treat it like a personality trait. Yet loud snoring with excessive daytime sleepiness is a classic warning sign for obstructive sleep apnea. In obstructive sleep apnea, the upper airway narrows or closes during sleep, breathing pauses, oxygen can drop, and the brain briefly wakes to reopen the airway. These arousals can happen many times each hour. The person may not remember them, but the body remembers. Sleep becomes fragmented, and deep sleep becomes harder to sustain. A bed partner may notice pauses in breathing that end with a loud gasp. Other symptoms can include morning headache, poor concentration, low energy, and lower interest in intimacy. High blood pressure is a common associated finding. Alcohol, sedatives, and sleep deprivation can worsen the problem because they relax throat muscles and make a narrow airway more likely to collapse. Anatomy matters too. A smaller jaw, nasal congestion, and certain throat shapes can predispose to obstruction. Many women after 40 miss this because the stereotype is a heavy snoring man. But women can have obstructive sleep apnea too, and menopause can shift risk. Some women report insomnia, anxiety, or frequent awakenings rather than obvious loud snoring. If you wake with dry mouth, if you grind your teeth, if you have morning headaches, or if you feel sleepy during the day even after enough hours in bed, this deserves attention. This matters for beauty because fragmented sleep and low oxygen stress the body. They can increase inflammation signals, worsen fluid retention, and keep cortisol higher. Many people chase skincare solutions for under-eye circles, while the real driver is repeated micro-awakenings and poor breathing during sleep. When breathing improves, the change often shows in the eyes first, because under-eyelid fullness is strongly linked to sleep quality. The first step is to take it seriously and get evaluated. Overnight sleep studies can confirm the diagnosis, often using pulse oximetry along with other measures to track breathing and sleep stages. Treatment depends on severity. In severe cases, continuous positive airway pressure delivered overnight through a tight-fitting nasal mask can splint the airway open, prevent obstruction and arousal, and lead to rapid improvement in symptoms. In milder cases, weight loss and mandibular advancement devices may help. Some people also benefit from positional strategies that keep them off their back during sleep, and a few benefit from surgery, depending on anatomy. On nights when you suspect breathing is the issue, avoid alcohol and sedatives, and sleep on your side if that is comfortable, because that can reduce airway collapse for some people. Keep nasal passages open by treating congestion, because mouth breathing can worsen dryness and snoring. Yet the key point is this: you cannot outwork a breathing disorder with discipline alone. Proper evaluation and treatment can transform sleep, energy, and the appearance of the face because the body finally gets uninterrupted cycles of repair. On the other hand, Ritual 1 is the most powerful beauty ritual because it calms the mind, and a calm mind is what allows deep sleep to show up. Ritual 1 is a practical version of cognitive behavioral techniques for insomnia. You do not need fancy language to use it. You need a few rules that retrain the brain. First, give your brain a place to put unfinished thoughts before bed. About an hour before you plan to sleep, write down what is still on your mind. Then write one next step for each item. This is not emotional journaling only. It is a plan. The brain relaxes when it trusts there is a plan. When the brain feels uncertain, it keeps scanning and rehearsing. Second, use stimulus control. That means the bed is for sleep and intimacy, and you go to bed when you are sleepy, not when the clock tells you it is bedtime. If you lie in bed awake for a long time, the brain learns that bed equals wakefulness. So if you cannot fall asleep after a reasonable period, get out of bed, go to a dim room, and do something calm until you feel sleepy again. Then return to bed. This can feel annoying at first, but it is effective because it breaks the association between bed and worry. Third, add relaxation as a bridge. Pick one technique and repeat it every night. A simple one is slow breathing with a longer exhale. Another is progressive muscle relaxation, where you gently tense and release muscle groups from feet to face. Many people hold tension in the jaw, forehead, and shoulders without noticing. When that tension releases, sleep becomes easier, and the face often looks softer the next day. This is where beauty shows up quickly. A relaxed face at night tends to become a relaxed face in the daytime. Fourth, manage expectations. Older adults rarely sleep as much as younger adults, and some night waking is normal. The goal is not to chase perfect sleep by forcing it. The goal is to reduce the habits that fragment sleep and to build a routine that makes deeper sleep more likely. Anxiety about sleep often becomes its own sleep disorder. So replace the thought "I must sleep now" with the thought "I am building the conditions for sleep, and sleep will come." If you wake at a consistent time in the night, like 3 in the morning, use the same approach. Do not negotiate with your mind. Do not open the bright light. Do not check messages. Keep the room dim. Use slow breathing, and remind yourself that being calm is already a win because calm allows sleep to return. If you cannot return to sleep, get out of bed for a short, calm activity, then return when sleepy. Behavioral and psychological treatments for chronic insomnia include multi-component brief therapies and single components like stimulus control, sleep restriction therapy, and relaxation therapy. Sleep restriction therapy can be powerful, but it should be done carefully because it can temporarily increase fatigue. For most people at home, you do not need a strict protocol to start. Start with the wake time anchor, reduce naps, and use stimulus control and relaxation. These steps alone can shift sleep depth in a meaningful way. This is also a good place for a second comment check-in. Leave a comment with the biggest thought that keeps you awake at night, because most people are not losing sleep to random ideas. They are losing sleep to the same loop, and naming the loop is the first step to shrinking it. Finally, once the 6 rituals are in place, the biology behind the younger look becomes clear, because sleep is a repair program that runs in cycles and depends on stability. During the night, the brain cycles through stages of sleep. Some stages are lighter, some are deeper. Dreaming sleep, called rapid eye movement sleep, supports learning, mood regulation, and emotional processing. Deep sleep supports physical restoration and helps the body run repair systems. When sleep is fragmented, you spend more time in lighter stages and less time in the deeper stages that feel restorative. Even if you spend enough hours in bed, the quality can be poor. When quality is poor, the body stays closer to a stress state. Cortisol can remain higher, and inflammation signals can remain more active. Blood sugar control can be less stable the next day. Those shifts have visible effects. Higher inflammation can worsen redness and breakouts in some people. Poor blood sugar stability can increase cravings and water retention. Higher cortisol can tighten facial muscles and keep the jaw clenched, which changes how the face looks and how it feels. Skin also has a barrier. That barrier helps hold water inside and keeps irritants out. When sleep is poor, barrier recovery can slow. The skin can look drier, more sensitive, and less even. Research links chronic poor sleep quality with more signs of intrinsic skin aging and diminished skin barrier function, and controlled studies in women show that even a short run of sleep restriction can alter skin and facial appearance. You do not need to fear that. You need to respect the signal. Sleep quality matters. This is also why Ritual 3 matters. Darkness and quiet allow cycles to run without interruption. It is like washing clothes in a machine that keeps stopping mid-cycle. The clothes never get fully cleaned. When your sleep cycles keep stopping, your repair never completes. A calm environment lets the cycles complete. Ritual 2 fits here as well. Obstructive sleep apnea repeatedly disrupts sleep and can drop oxygen. Oxygen is not only a brain issue, every tissue uses oxygen to repair. Treating obstructive sleep apnea can quickly improve symptoms, including daytime alertness, and it can support better blood pressure control. When sleep is stable, the face often looks less inflamed, and the eyes look more awake. Still, the real value comes when you can tell why a night broke apart, because different wake-ups need different fixes, and guessing wastes months. Some nights break because the body is uncomfortable. Some break because the brain is over-alert. Some break because breathing is unstable. Some break because temperature or bladder signals keep firing. When you treat every wake-up as one problem, you miss the lever that would have helped. So here is a simple way to sort your nights without turning it into a project. When you wake, pick the most likely reason from 4 buckets. The first bucket is body discomfort. This includes pain, reflux, itching, or restless legs. Pain can be quiet all day, then loud at night when there is nothing else to focus on. Reflux can wake you even when you do not feel classic burning. Restless legs can feel like a buzzing or pulling sensation that improves only with movement. The second bucket is temperature and hormones. Hot flashes, night sweats, and a room that is too warm can create repeated arousals. Even subtle overheating can keep you in lighter sleep. The third bucket is breathing. Snoring, dry mouth, morning headaches, and daytime sleepiness can point to obstructive sleep apnea, even when you think you sleep enough hours. The fourth bucket is the mind. This is the wake-up where the body feels fine, but the brain starts rehearsing. Work, family, health worries, and unfinished decisions tend to show up here. Once you name the bucket, you apply the matching fix. If discomfort is the bucket, the fix is earlier in the evening. Eat earlier and lighter if reflux is possible. Support joints and neck with bedding that reduces strain. If pain is persistent, get it evaluated because chronic pain and poor sleep amplify each other. If restless legs are present, talk to a clinician because iron deficiency and certain medications can contribute, and treatment can be very effective. If temperature is the bucket, the fix is environmental. Keep the room cooler. Use breathable sheets. Use layers you can adjust in seconds. Keep a spare top close by because staying soaked and irritated keeps the nervous system active. Alcohol and heavy late meals can worsen night sweats in many women, so removing them for a week is a clean test. If breathing is the bucket, the fix is medical evaluation and smart positioning. Side sleep can help some people, avoiding alcohol late can help, and treating nasal congestion can reduce mouth breathing. However, if symptoms suggest obstructive sleep apnea, evaluation matters because proper treatment can be transformative. If the mind is the bucket, the fix is training. That is where Ritual 1 becomes your strongest tool, because a calm mind is the doorway to deep cycles. Meanwhile, there is one skill that turns these rituals into a reliable system, and it is a short return to sleep sequence you can use without thinking. When you wake in the night, your goal is not to force sleep. Your goal is to keep the brain from building a full wake state. Start by keeping the room dim. Avoid time checking. Avoid bright screens. Then place your tongue gently on the roof of the mouth and let the jaw loosen. Many women clench at night without realizing it. Next, breathe slowly with a longer exhale. A simple rhythm is an easy inhale and a longer exhale, repeated many times. Then scan the face and soften the forehead, eyes, and jaw again. Facial tension is a direct signal of nervous system alertness. If sleep does not return after a reasonable period, get out of bed briefly, sit in a dim room, and do something calm until sleepiness returns. Then return to bed. This protects the bed as a cue for sleep rather than a cue for thinking. This sequence matters for beauty because it prevents the wake-up from turning into a full stress event. When wake-ups stay calm, the face tends to look calmer in the morning because stress chemistry did not escalate. Afterwards, it helps to see the night as a timeline from dinner to midday because a younger look is often decided hours before you close your eyes. A heavy late dinner can set off reflux or temperature swings. A late caffeine drink can keep the brain in lighter sleep even if you fall asleep quickly. Alcohol can sedate you early, then wake you up later. Bright light and scrolling can delay the natural timing that helps sleep start. So treat the evening as a runway, eat earlier when you can, and keep late food modest. Dim the light earlier than you think you need. Choose calm input for the brain. Keep the room cooler. Then let the wind down routine run the same way most nights. When you do this, the morning often changes in a predictable order. Puffiness tends to reduce first. Then the mood steadies. Then cravings calm down. Then the face looks softer, and the eyes look more awake. Those changes are not cosmetic tricks. They are signs that your stress system and your sleep cycles are stabilizing. That said, there are two under-discussed issues in women after 40 that can keep sleep broken even when habits are good, and they deserve attention because fixing them can be a bigger beauty upgrade than any product. The first is frequent nighttime urination. Sometimes it is simply too much fluid late in the evening. Sometimes it is the bladder that is more sensitive. Sometimes it is sleep apnea, because breathing disruptions can increase nighttime urination signals. If you wake to urinate many nights per week, reduce fluid close to bedtime, limit alcohol, and speak with a clinician if it persists, especially if you have diabetes, high blood pressure, or swelling in the legs. The second is low mood or anxiety that changes sleep architecture. Depression can cause early morning waking. Anxiety can cause difficulty falling asleep or repeated awakenings. These are not character flaws. They are treatable conditions. When mental health improves, sleep often improves, and the face reflects that change through less tension and more stable energy. Finally, here is a simple way to add value without adding complexity, because the best plan is the one you actually repeat. The anchor is the consistent wake time. The protector is the fence around late caffeine, alcohol, and heavy late meals. Then add one comfort upgrade that can be a cooler room, a fan, breathable bedding, or a white noise solution that prevents sudden sounds. Then add one mind-calming tool that can be the 1 hour before bed plan on paper or the return to sleep sequence you practiced. This is enough to create momentum. After a week, add Ritual 4 and Ritual 3 if you have not already. Then refine based on your bucket pattern. In short, deeper sleep and a more youthful glow come from stable cycles, calmer wake-ups, and better breathing, and those are skills you can build step by step. Try the 6 rituals and the return to sleep sequence for 7 days, and watch for the first honest signals of progress: less morning puffiness, steadier mood, and eyes that feel more awake. Subscribe so you stay close to the next practical protocol for stronger energy, steadier mood, and beauty that looks natural because it is built from deep sleep and a calmer nervous system.